welcome back everybody to Creating Hanley. I am Kimberly at Creating Hanley, and today we are talking about 15 health effects and benefits of Swedish massage. Now this is going to be specifically for Swedish massage. There are many different types of massage and body work out there in the world, but today we are talking about Swedish only. And I happen to be a Swedish massage instructor at the local school here in the Pittsburgh area. And so I have a little bit of an expertise on that type of modality. So let's talk about 15 health benefits and effects of Swedish massage on your body. Now, I just want to say, if you find this valuable, this information valuable or helpful to you in any way, please share it with others. Please hit that like button and subscribe, and you will be notified in that little bell, ding-a-ling-a-ling, that you will be notified when new material comes up, whether it be in massage or health, healthcare of some sort, or in the furniture painting or the quilting or whatever, the gardening stuff that might come up. Anything is, but anything is a go here at Creating Hanley. We just make every day beautiful, right? And check out the Food for Thought Fridays on this channel, because every Friday I bring you a mantra or a quote of some sort to go about your day with, to think about, food for thought, to think about over the weekend, to think about for that day, for the following week, and try to bring joy, happiness, gratitude, and peace into your life. All right, so let's get to it. I'm going to bring you 15 potential health effects and benefits of Swedish massage. So, I just want to say a little bit of background of Swedish massage. Now, massage in general has been around this planet for about 3,000 or so years, probably actually way longer than that, since the time that hominins ruled the planet. If they got a bump or a scratch or a hurt or a broken bone or something, they instinctively, protect that area. And what do we do when we hurt, we hurt our shins or we bump our elbow? What do we instinctively do? We get a Charlie horse or, like a funny bone or something, and we instinctively, we take our hand to that area that hurts. Our neck hurts. What do? We rub it. We get a headache. What do? We rub the area, right? We instinctively know to heal our body that way. And so massage has been around since probably the beginning of time. Animals, they lick their wounds or whatever. So even they try to help heal themselves. So that's basically massage is helping to heal themselves. Now, we have created all these different types of modalities. We have found, meridians and energy lines in the body. And we found ways to get out trigger points and areas of tension in the body through a rhythmical or a patterned way of dealing with certain elements in the body, certain features, certain factors. So we're just going to talk about some of the health benefits or effects that massage can have, and specifically Swedish massage can have on the body. Now, usually this is done by another practitioner. So in the United States, we have schools set up specifically for massage, and we have licensure in certain states. Almost the majority of every state in the United States has their own licensure within that state. So there are parameters, specific guidelines, definite, I already said the word parameter, but we have, definite standards to follow in the United States. So each state has their own, but each person giving massage, especially in Swedish massage, has to meet a certain guideline, has to meet a certain goal, has to meet certain criteria, a certification, or even a licensure in order to get employed in a specific place, facility or hospital or what have you. So keep that in mind when you're looking for your massage therapist. It doesn't matter where you are in the U.S. Check out your state board. Usually if there's a licensure in the state has a state board for massage therapy of some sort. And there are parameters that each practitioner or body work practitioner or body worker needs to follow, especially if it's a Western type of massage, Western style massage therapy. Eastern style, the Asian types of body work have a different structure, so they may not fall under the same category. So just check that out. So that's my intro to you guys, my little what is it called, disclaimer of sorts. So check it all out before you go, seek anybody who's put up a shingle on the sidewalk. Hey, I give massages. Check that out. So anyway, massage has been around for a long, long period of time. Swedish massage specifically works with soft tissue of the body. So what is soft tissue? Skin is definitely the number one soft tissue that we work directly on. We also affect muscle. So yeah, it's nice to rub oil on the skin, and there are some techniques that work with directly on the skin, and then there are some techniques that work directly underneath the skin, so you're getting fascia. And what is fascia? Fascia is connective tissue all over the body. Fascia connects every cell together, so it's kind of like the saran wrap in your body. Every cell is protected by fascia, is connected by fascia. So it is in the skin, is directly underneath the skin as well. So it doesn't take much pressure to affect fascia, to move fascia, to quote, melt fascia, to help unwind or unbind fascia. So it doesn't take much pressure. A lot of people think, oh, well, really got to hammer it in there and get, deep into the layers of the body. Well, it doesn't take a lot of pressure to do that, guys. So if your massage therapist starts hurting you and you're holding your breath and you're holding tension in your body, you're kind of guarding because, oh my gosh, it hurts too much. That is too much pressure. And you need to tell that therapist that is too much pressure that they're using, and maybe adjust that pressure to whatever your body can handle. And don't you think that more is better, because more is not better. More is actually worse. You're not getting that bang for your buck by getting more pressure. And I actually have a video on my pressure rant, my deep tissue versus deep pressure. So check out that video, my little rant there. So I'm going to get off that soapbox. But anyway, soft tissue, let's go back to that. So we're at the skin, we're at the fascia, and then muscle is under that. So muscle, it does not take a whole lot of pressure to effect some change in muscle either. So even just, how when somebody puts a hand on your shoulder, and that kind of feels, depending on who the person is, it kind of feels soothing. They put a hand on your upper back or your upper arm, and you go, yeah, and then you feel like this physiological change in your body. It doesn't take much pressure to do that. On the converse to that, if somebody that you maybe don't like or don't want touching you touches you, you stiffen up, right? It doesn't take a whole lot of pressure to do that either, right? It's just the act of them placing your hand or their hand on your shoulder or your back or your arm or whatever, or some place that you don't want touched. Just the act of them doing that, you start to bristle, right? It doesn't take much pressure either, does it? Right. So pressure plays a role. So go check out that video. Also, we're affecting tendons and ligaments. Now, keep in mind, tendons and ligaments are different. It's kind of the same type of material in the body, the same connective tissue, but tendons connect muscle to bone and ligaments connect bone to bone. Joint capsule is a connective tissue surrounding the joint itself. So there are different types of soft tissue in the body that we as Swedish massage therapists effect. So keep that in mind too. So we're working with all these different types of tissue when we are doing Swedish massage. And there are different different techniques that we use to affect all of those different types of tissue in the body. So that's a long intro. Let's get to our health effects and benefits. Now, the one that pretty much everybody thinks of right away is stress reduction. So number one, stress reduction. When you get a Swedish massage, everybody's like, oh, I just want to relax on the table. I just had a rough day or a rough week or a rough life. I just need an hour to relax, or an hour and a half, or whatever, to relax on the table. And they get to actually sink down into the table and maybe even fall asleep. Maybe for that hour or half an hour, they're actually relaxed enough that they take a little snooze, take a little nap right on that table. Maybe, home life or work life is so stressful, they just need this place of tranquility, this calm, this peace, and they get to actually relax their body, relax their mind, relax the whole heart rate there, the adrenal system. They actually just bring that nervous system down just enough that all that tension that they're holding is coming down. So that also decreases the production of stress hormones, because if you're not in that stressful situation anymore, that just automatically happens. Those stress hormones can just stop producing because you're in a safe zone. So stress reduction is probably the number one reason why people go for massage. And number two is pain relief, right? Because you think, oh, I'm hurting, I need a massage. Pain relief is probably the number two. Those are probably interchangeable depending on what study you see or what survey is done. But pain relief and stress reduction kind of go hand in hand. So pain relief can help in a couple different ways. One, in chronic pain. So you just get injured for some reason. You hit your funny bone and you can, rub that out. Pain relief, chronic pain, or acute pain. So it just happened. Acute pain is it just happened within maybe 24 hours. Now, chronic pain happens after 72 hours. So if you still have pain after 72 hours, 2 months, 3 months, 3 years, 30 years, that's chronic pain. So massage can help relieve some of that pain, either in acute or chronic. And those two are treated differently. So if you're in acute pain phase, let your massage therapist know. First, it depends on how severe it is. You might need to get doctor's release first, doctor approval to get massage therapy. And then, so again, depending on how severe it is and what is going on. If you have a fractured bone, do not seek your massage therapist. Go to the ER right away, because we're not going to be able to do anything with that fractured bone. But after it's been set and casted and whatever else is going on, we can work on the joint above where the break is. So, if you break your arm here, we can work from the elbow up. If you break your arm here, we work from the shoulder up. We don't even work on that entire arm at all. So depending on where the break is in your body, again, go seek immediate medical assistance, and then after a while, then you can come see us. If you've had surgery, again, get all your doctor stuff done, your PT, and then get approval to go get massage. So, stress relief, pain reduction. Another reason why people might get massage therapy is for improved circulation. So some people say, I'm cold all the time. My hands and my feet are cold all the time. Maybe you have Raynaud's, maybe you don't. Maybe you just have what people call poor circulation, which I don't know about that one. If you just come on my table and you say, hey, I have poor circulation because my feet are cold. I don't know. So, but anyway, it can improve circulation in the body in that here's what happens. You are horizontal on the massage table. You are relaxing. So your body is not in a fight or flight or, resist kind of a mode. You actually get to relax. Blood vessels can relax then at that point. Your adrenals can relax. Your body can go into this nice, easy rest and digest phase. And so blood vessels can open up maybe a little bit. They're not all constricted. They can open up, and automatically blood circulation improves. When blood circulation improves, the heart rate can decrease a little bit, and the heart working capacity doesn't have to work so hard. That was hard to say. I didn't have to say it that way, but the heart does not have to work as hard. It does not have to pump as hard when you are in a horizontal state of being, because the body just flows sideways. It's not going up and down. in the body. So, I mean, just in and of itself, being in a horizontal state doesn't necessarily mean that you have to get a massage in order for your circulation to improve, but just by being in that state. But also what happens is the mechanical effect of us pushing blood towards the heart actually helps to reduce the work output that the heart has to do. So just that mechanical motion of pushing blood towards the heart will help improve circulation just automatically that way. If you are finding any value in this video, please hit like and subscribe. If you have a friend who you think should see this video for some reason, share this video and leave a comment. Have you had a massage in the past and you said, hey, oh my gosh, yes, this helped with my blah, blah, blah. This helped improve my blah, blah, blah. Leave a comment below how massage helped you. And if it didn't help you, maybe you thought, oh, I was supposed to, feel like this blissful state, but I didn't quite feel this blissful state after a massage. What did you feel after that massage? So go ahead and leave a comment below. So what do we have so far? Let's recap. We have stress reduction, we have pain relief, we have improved circulation. What else can we do here? How about number 4, enhanced flexibility? Now, let's talk about flexibility. A lot of times people, they might complain, oh, I have a pain here, or I have a pain somewhere, and I'm just stretching, and I'm stretching so much, and I'm stretching, and all they're doing is stretching, and nothing is releasing. Well, if you have a tight muscle already, and you're trying to stretch this tight muscle, so take a rubber band, go out, I'll wait, go find yourself a rubber band, I'll wait. So, stretch that rubber band. Now, if it's tight, if you feel like you are recreating your tight muscle with this rubber band, now go ahead and stretch that. Stretch that rubber band. If you already have a tight muscle and you're trying to stretch it, is it really going to release? Is it really going to relax? I don't think so. I mean, if you have tension in some area of your body, if you put more tension on it, does tension equal relaxation? No, tension and tension equals more tension, right? So here's what we can do for enhanced flexibility. We can take, as a massage therapist, we can take your joint through a range of motion. So, for example, I have an elbow here. The only thing this elbow can do is flexion and extension. So here's flexion, decreased angle. Here's extension, increased angle. So flexion and extension. This is the only thing that this joint can do. Now, we can also do some rotation here at the joint because these two bones can rotate. There are two bones in your forearm. They can rotate over one another, and that happens here at the elbow. So you have a little bit of internal and external rotation, or what we call pronation and supination. So a little bit of pronation, palm down, and supination, palm up at the elbow, and then flexion and extension. So if you have a limited range of motion in one of these directions, pronation or supination, flexion and extension, what we can do as massage therapists is take your joint through its range of motion. And that range of motion is only those two things, flexion, extension, and supination and pronation. So as a massage therapist, we can just take it through its range. And whatever your endpoint is, say maybe you don't have full extension at the elbow. Well, if there's not a physical reason why, an anatomical reason why, maybe I should say an anatomical reason why, like the bones are too short, or you had a break somewhere in the past and your elbow bones don't really come together the correct way. If it's maybe musculature, a ligament even perhaps, or a tendon, remember tendon connects muscle to bone, so we can potentially increase that flexion incrementally and temporarily. So we can take your joint through its range of motion. We can actually do a stretch with it to try to stretch that. But here's the thing with increasing flexibility, that's something that you have to do every day on your own. And you have to do it very purposefully. So you can't just like go, oh, yep, okay, I'm good, I'm stretched, right? It has to be purposeful, and it has to be in intent, and it has to be like a commitment, your commitment. If it is in fact, a decreased range of motion. So you have to figure out what else is going on there. Was there an injury? Are you drinking enough water? Maybe your ligaments, tendons, muscles are tight because you're not drinking enough water. So check that out also. So enhanced flexibility, sure. What about muscle relaxation? So we talked about, whole body relaxation, and that's from the nervous system relaxing, and maybe the adrenal system relaxing. But what about muscle relaxation? So techniques kind of like effleurage and petrissage in Swedish relaxation are designed to help relax or release tension or tightness in muscles. Now, we don't say knots in this field. Everybody says, oh, is that a muscle knot? Well, knots, I have another video on that too. I have a cord that I use, and I tie it up in knots. Knots don't exist in muscle. Our muscle does not tie up in a knot like that. But we just think, oh, it's like a ball back there. That must be a knot. Sometimes we call them adhesions. Well, adhesions are just stickiness in tissue. So if we have tissue that's supposed to work like this, like pistons in a car, in a combustion engine, maybe I should say that. In a combustion engine, there are pistons in the engine that make the engine work and make the car move. Same with our muscle. Our muscles have proteins, actin and myosin, that work as little pistons. And sometimes if they become stuck, we can call that an adhesion because it's stickiness, right? It gets stuck. So maybe those proteins are kind of stuck together for whatever reason. Or maybe it's bound fascia that is just maybe scar tissue, maybe it's scarred. What we can do is make it more functional as massage therapists. We have a couple techniques to make that more functional. However, that's not a one-time thing. Like, you don't get one massage and then boom, you're magically healed. That takes some time to do that. So that can also be another effect too, muscle relaxation. What about improved sleep? Hey, everybody needs great sleep, right? So Swedish massage can help decrease, like I said before, decrease the nervous system response to stimuli in the environment. So we decrease that. We decrease the adrenals always being on. We get that to relax. We get the heart rate to relax a little bit, bring that hypertension down some. And then we can actually induce a deeper sleep. We can go to sleep faster, and maybe we get less sleep disturbances at night. But that's also due to sleep hygiene, which is a whole different video, and we'll have to check that out at a later time. But improved sleep is also another one. How about boosting the immune system? Can Swedish massage boost the immune system? Well, in a way, yes. Everything that I just said so far can help the body maintain homeostasis, which is where it wants to be. The body is happy in homeostasis. So it goes through its regular processes and routines every day, and it does its normal thing every day. But then when it gets an onslaught of bacteria and virus and microbes of some sort, yeast and whatever, allergens of some sort, the body's immune system kicks in because it goes, uh-oh, this is not normal. This is not homeostasis. And so the immune system kicks up and says, all right, we're going to fend off this illness immediately, and we are getting rid of this stuff. Now, the body does this on its own, does it on its own. So does the does the massage help with, quote, detoxification and boosting the immune system? Well, the body detoxes on its own. And actually, that's my next point. So I'm going to tie these two in together. Detoxification and the immune system. So the immune system may need a little bit of boost from time and time, depending on what's been going on in your environment, what you've been eating, what you've been doing with your body. It might need a little bit of extra help. If you're going on vacation and you're in airports and airplanes or on trains, planes, and automobiles, germs are floating around everywhere. And if you go to a land that you're not used to the plants or the animals or whatever, and you get like bird dander or allergens from plants or flowers or whatever, maybe you need a little extra boost. So a massage can help with that. So also detoxification. Let's throw this in because this is a little bit controversial. The body detoxes on its own. That system is called lymphatics. Well, there's actually a couple of systems that help with the body detoxing, but lymphatic drainage is a specific type of massage that is not Swedish, but manual lymphatic drainage is a specific type of body work or massage therapy that helps to push the lymph gently through the body. So that in and of itself is its own modality that is not included in Swedish. But every blood vessel has a lymph vessel mated next to it. So every time you're pushing blood, you're pushing lymph through the body as well. So that can help increase detoxification in the body. Now, what's toxic in your body? You got to think about that. What's a toxin? So heavy metals are toxins. Maybe foods that you eat that are allergic that have maybe ingredients that shouldn't be there, like colors or some kind of ingredient that is toxic to the body. So if you're eating that, and I don't want to give out food names or anything like that, but like ingredients that shouldn't really be in food, maybe BPAs or something along those lines, like I almost want to say food preservatives, but like food preservatives, that can clog up the system maybe a little bit. I mean, that's so controversial. So anyway, massage can maybe help get that through. If you do an abdominal massage to help, push all the ways through the abdominal region, that's great. Do that. All right. Another benefit can be a mental health benefit. Maybe you just need a break from all the extra stress, the anxiety, the depression that everybody has. So massage can help release some endorphins. Maybe we talked about reducing the stress hormones. So it can have some mental health benefit. And maybe you just need a break. You just come into the massage room and you look at all the nice things in the room and the ambiance and the soft music and the soft lighting and all that stimuli subsides. Maybe it doesn't go away completely, but it subsides. So you get some mental health benefits from that. You get to take a break from your, outside everyday life, even for just a little bit. So you can have some mental health break from that, mental health benefits. What about headaches? So we talked about headache in the earlier in this video. We kind of automatically go, oh God, my head hurts. And we just massage ourselves when we get headache. But believe it or not, there are some specific techniques that massage therapists can do, even in Swedish massage, that help to alleviate headaches and even migraines as well. So they may be outside the Swedish massage modality. Maybe we're talking about cranial sacral work. Maybe we're talking about lymphatic drainage. Maybe we're talking about Reiki therapy. Reiki is energy work. It doesn't even touch the body, but sometimes that can help relieve some of that tension as well. Let's talk about improved posture. Do you think massage will improve posture? If you become more aware of how your body is hurting, maybe the massage therapist hits a spot and you're like, well, I didn't even know that hurt until you touched it. I hear that all the time. I didn't even know that hurt until you touched it. Maybe you become more aware. Oh yeah, my shoulder blades are constantly killing me, like right in the middle of my back. So you become more aware of how you're using your body. And your massage therapist can tell you too, hey, maybe don't hunch forward so much when you're on the phone or driving or, at work on your computer or whatever. Maybe take a break, have a posture break, and sit up straight and walk around a little bit. So it can help with that in that way. Enhanced skin health. Hey, think about this. We are working directly on the skin. So this motion of friction directly, and it doesn't even have to be a lot of friction. It's just a little bit even. It can help exfoliate the skin, slough off all those dead skin cells. Yeah, think about that during your massage. It can improve skin tone and even texture and give your skin a nice healthy glow. So that's another effect that massage can have. We talked about reducing hypertension, like blood pressure in the body, just by being flat, just by being horizontal. Your heart does not have to work as hard, so heart rate comes down. The mechanical motion of massage, pushing blood up towards the heart, can just help with reducing hypertension. So we talked about that. And better digestion, I did mention that. Some massage techniques work on specifically moving material through the gut system so that we can excrete it. And that's waste that we don't need. Hey, toxins can be in there too, so we can get rid of that. Fantastic. All right, and I'm going to throw in number 15 here. Is going to be a little bit different. So number 15, and I know this video is long, and if you are getting any benefit whatsoever, please let me know. I really appreciate you subscribing and telling your friends so they subscribe too, so we can be all on the same page and have a healthier world together. So number 15, Swedish massage can help with this. You control your health care. It is under your control. You decide when you get massage, how often you get massage, what type of massage you get. You're in complete control of that. So it is self-directed. It is your health care. It is the way you want to live your lifestyle. So that is number 15. You're in control. Fantastic, guys. Hey, thanks. I know this was a long video. Thanks for sticking around. I love it when we all get on the same page. And leave a comment and stay tuned for more video. We'll be back with more soon. Bye for now.